Hey everyone, good morning. This is going to be the episode 2 of 10 topics and 10 MCQs so short. So for the PDF guys, link in the description. So let's start without any delay. The first one is guys the management of eclampsia. Okay, so you know that what is the preeclampsia and eclampsia. Preeclampsia means what? Pregnancy induced hypertension called as preeclampsia. So first of all, you have to know the some basic terminology in the hypertension pregnancy, such as what is gestational hypertension, what is preeclampsia, what is chronic hypertension, what is chronic hypertension with superimposed preeclampsia, and what is eclampsia. Okay, I think you guys know about these terminologies. Okay, so I'm going to discuss about the management of the eclampsia. So right now, see what is the drug of choice for the eclampsia? It is the magnesium sulfate. Okay, so we are having for the management of eclampsia gas, we are having the some regimen called a Pritchard regimen. Okay, Pritchard regimen. So see here in one ampoule of the magnesium sulfate, we are having total 2 ml of solution. How much? 2 ml solution, and after 2 ml solution we are having 1 gram of magnesium sulfate. Okay, see out of we have see in 1 ml in 1 ampoule of the magnesium sulfate we are having total how many solution? 2 ml, total 2 ml. It out of 2 ml we are having how much mgso4? 1 gram of mgso4. Okay, see here the what is the loading dose is the 4 gram IV over 4 minute immediately. It means see how much. See 4 gram means how much? 4 grams. If I want to give 4 grams, it means how much? It means how much total is the how much total? 1 ampoule is equal to 1 milligram. 1 gram means 4 grams. It means total 8 ml. Total 8 ml, isn't it? Total solution is 8 ml. Okay. Plus you have to add 12 cc, 12 ml of NS solution. Okay. Got it? See, loading dose is 4 gram. Okay. See, 4 gram means how much? It means you have to break 4 ampoules. 4 ampoules is equal to how much? Total 8 ml. Okay. From 8 ml, you have to add that 12 ml of NS saline or normal saline. The total will be how much? 20 ml. Okay. It means we have to add loading dose is the 4 grams 20 ml. IV you have to give what you have to give immediately. Run you have to give slowly up to 4 to 5 minutes. Followed by for IV it's how much? 4 gram. For the IM it is 10 gram. See 10 gram means how much ml? 20 ml. What is the maintenance dose? It is the maintenance is the 5 grams IM. What is the therapeutic range? Is a 4 to 7 milliequivalents. See, max sulfate it's going to be very toxic. That's why you have to maintain, how to check the serum MgS4 levels always. If it is toxic, then what is the antidote? It is the calcium gluconate. It is the calcium gluconate. That's why you have to always while giving this MgSO4, you have to always check the MgSO4 levels, serum MgSO4 levels. If MgSO4 levels is more than 10 milliequivalents, this is going to have we are having the there is a knee jerk loss. This is the going first sign. More than 12, then the patient will be have respiratory distress. More than 15, respiratory paralysis. More than 25, cardiac arrest. Like this one, these are the questions they are going to ask in the exam. Management of hypertension in pregnancy. Always the first drug of choice is the labetalol. For the chronic hypertension, it is the methyl dopa. If it is the refractory hypertension, drug of choice is the sodium nitroprusside. As you know that ACE inhibitors and ARBs are contraindicated. Diuretics may be used, but it is used after 20 weeks only. What is the drug of choice for the prevention of the pregnancy-induced hypertension? It is the aspirin. If the patient is pregnant with and also having the asthma, then you have to always use the CCB like nifedipine. Okay. So coming to the here, coming to here, guys. Coming to here, how they are going to ask, how they are going to test us in the examination. How? See, this is going to very simple. They're not going to ask very deeply. So first of all, they are the diuretics. Okay. So in what part of the nephron, these diuretics are going to act? So for example, they will just mark as here, they will just mark here this part. They will act, they will ask that which of the following will be going to act. So you have to know that it's going to be Vatra, it's going to be potassium sparing diuretics such as spironolactone and amiloride. If they ask you here, it means it is the mannitol estrogeramide. These are the what they are going to ask. Simply. Okay. So just remember this. Remember this in what part of the nephron that they're going to ask. Okay. And remember the mechanism of action also. The most important one is the thiazides here, like hydrochlorothiazides, chlorothalidone, and the metallazone. They inhibit NaCl reabsorption in the early part of the DCT and decrease the diluting capacity of the nephron. So hence decrease the calcium excretion. Okay, like this one you have to remember. Loop diuretics such as furosemide, butyrate, torsemide. It inhibits the contrast system of the water Na plus K plus 2Cl minus of the thick ascending limb loop of Henle. Okay, this is going to loop the ascending loop of Henle. This is what you have to go into master. That's it. Okay, please try to once take a look. See, coming to the Parkinson's versus Alzheimer's disease. See, Parkinson's versus Alzheimer's disease. What happens here in the Parkinson law, there is one bad protein is called as alpha-synuclein. Alpha-synuclein protein is going to degrade, that is going to accumulate in the midbrain. That is the nigra, which is here itself. In the midbrain, in the where in the substantia nigra. Okay, see, alpha synuclein protein is a bad protein, is going to accumulate in the substantia nigra. Then how that's how the patient is after the accumulation of this one, where in the substantia nigra the patient may show these following symptoms. A group of alpha-synuclein protein in the substantia nigra is called as Levy bodies. It's called as Levy bodies. So hence the patient will show there is a pill rolling tumors. Okay, pill rolling tumor. There is a rigidity and there is a bradykinesia, snuffling gait. Remember, right? There is also micrography. The handwriting will be very small. There is a postural instability, tendency to fall always. See, in Parkinson disease, patient will always falls only front or not back side. See, that's how the types of person they're going to ask here. And also there is a bark phenomenon. There is a bark phenomenon is that in the early there is a hypothesis is that there is a loss of there is a anosmia plus constipation. So these are the early signs and symptoms of the Parkinson's disease. Okay, by the Park hypothesis, they told that in the early signs and symptoms of the Parkinson disease is the anosmia plus constipation. Okay, so this how that's how they're going to ask in the examination. See which neurotransmitter is there is a low dopamine here. Okay, so drug of choice will be the what? Always will give the levodopa plus carbidopa. Okay, drug induced Parkinson, drug of choice is the benzoxazole. Done. Remember this. From the Alzheimer's disease, how it means they decrease acetylcholine here, the most common dementia in the older patient. Okay, remember here, next one, see, APO2 and APO4 they are involved in the Alzheimer's disease. See, APO4 causes the increase the risk of sporadic form, and APO2 decrease the risk of sporadic form. So they will ask you what apoproteins. Apoproteins 2 and 4 they are involved in the Alzheimer's disease here, and also we are having the here see neurofibrillary tangles. They are the intercellular hyperphosphorylated tau proteins. They are what are tau proteins contains neurofibrillary tangles contain group of neurofibrillary tangles called as what tau protein. These are insoluble cytoskeletal elements. Number of tangles correlate with the degree of remember here. Remember here. See here. Just okay. Tau protein. See here, dementia. Okay, dementia in Alzheimer's. It depends on the number of the neurofibrillary tangles. See, if there is a more number of tangles, it means there is a more what degree of dementia. So this is a very very important. Okay, now there is also one is a Hirano body. Hirano body means what? There is a intracellular proteinous rod in the hippocampus. Okay. See, simply in the Alzheimer's disease, what we are having? We are having the Hirano bodies. This is the tau proteins. See, and remember here, a group of type of tau proteins is called as what? Hirano bodies. Okay. Group of the neurofibrillary tang is called as tau protein. A group of tau proteins is called as Hirano bodies. Okay. But remember the degree of dementia is depends on the neurofibrillary tangles. Okay. So here is remember here there is a senile plaques in the gray matter here. Drug of choice is the donepezil, rivaroxaban, galantamine, and memantine. Memantine is the what? NMDA antagonist, and here is the donepezil is the most common. Okay, if they ask you, if they will give all these options, then you have to answer the drug of choice is the donepezil. If they ask you the patch, it is the rivaroxaban. That's how you have to remember in the Parkinson and Alzheimer's. See here, who is responsible for the handling investigations? See, remember here in India, we are having the here police inquiry and a magistrate inquiry. Here, remember here, from the police, we are having the criminal police. See, CRPC. How much number is the 174, and the magistrate inquest is the 176. Remember, these are the questions in the last examination. Police inquest and the magistrate inquest. The police is the 174, magistrate is the 176. Judicial magistrate. Remember, this is the DD. Mnemonic is the DDR. Remember DDR. C D for the death, dowry death. No. Remember. See here. Judicial death. See, judicial magistrate will inquire only the death in prison, death in child institution, death in custody, and the disappearance from the mental hospital. Mental hospital. These are the inquests done by the judicial magistrate. Executive magistrate, they will inquest for only for the dowry death and exhumation. These two are done by the what executive magistration. Coming to the courts in India. Okay, courts in India. I'm coming from the low to high. Low to high. The first one is the judicial magistrate. Judicial magistrate we having second class JM, first class JM, and chief JM. See how they're going to ask the question from which JM we are having the unlimited fines. It is the chief JM here. Remember, second is the session judges. We have the assistant session judges, additional district session judges. How they are going to ask the question is the which session judges having having we have power to say death sentences. It is the additional district session and judges. Okay, done. This is how, and which is confirmed by what? High Court. Okay, remember, judicial magistrate and session judges are under control of the state government, and the High Court and Supreme is the central government. That's it. Remember, I think you guys know about this all. Okay, please try to remember this one. What are the pregnancy changes during physiological changes during the pregnancy? Please remember this one. Please study, guys. And also we are having the smoke poisonings and their antidotes here. See, poisons such as the very most important one is the remember the amphetamine poisoning, cocaine poisoning, thallium. Remember, thallium is the alopecia. Okay, alopecia. There is a motheriosis, skin rashes here. Thallium water. There is a alopecia related. The tour I think everyone knows about that. It's also called a railway station or road side poisoning here. Later there is a what? There is a botanical line here. Stechinus poisoning. There is a what? A resembles the tetanus poisoning here. There is a apostothomas. There is a okay. Opium, meiosis, respiratory depression, coma. Here for the opium withdrawal, there is a what? There is a secretions. Rhinorrhea, diarrhea, and saliva. Amphetamine. Okay, increased psychosis, seizure, suicidal, urine liquid gold, which is called also called urine liquid gold. They also called as body packers. Cocaine, it is called a tactile hallucination. Magnus effect syndrome. Okay, remember this one. Coming to the pharmacology part here. We have to know about the anti-TB drugs. Know about the isoniazid, rifampicin, pyrazinamide, ethambutol, and delamide. The most important is the ethambutol water. It causes the red green blindness here. Isoniazid will cause the peripheral neuropathy. Rifampicin causes the what? Red urine drop. Pyrazinamide is the most toxicity, inhibit the cells, increase the uric acid. So hence it causes the gout here. Okay, remember from the bedaquiline. What is the mechanism of action? Bedaquiline, what happened? Bedaquiline, it inhibits the ATP triphosphate synthase. Okay, na ATP triphosphate synthase. Remember, it causes the QT prolongation. What are QT prolongation? Causes the bedaquiline, QT prolongation. Okay, and also remember here delamide and pretomanate. It also causes the side effect as the QT prolongation and inhibit the mycolic acid. That's what you have to remember. Coming from the diabetic drugs, you have to remember about the SGLT2 like dapagliflozin. And see, remember, this causes the loss of the glucose in the urine. That's what there is a side effect as the UTI, genital mycotic infection, chronic gangrene, and weight loss. Remember, this is drug of choice in the cardiac issues plus diabetic mellitus. Then you have to give the SGLT like dapagliflozin. DPP4 inhibitors, see here, all the names of this class of drugs are like girl name, sitagliptin, Sita, Vilda, Lena, Saksha. Okay, na? Remember, only Lena is safe in the CKD patient. Okay, so these are the DPP4 inhibitors. I think you know it's the metformin, sulfonyl areas like the glycoside, glimepiride, it causes the hypoglycemia. thiazolinamide. The example is the pioglitazone. These are the PPA or gamma activator risk for the bladder cancer. Just remember this, guys. This is score. I think everyone knows about this one. Just remember in my style. This is the remember here. I think everyone knows this one. See EVM, I verbal, E for I, V for verbal, M for motor. EVM 456 means 456 means 4 is the highest score, 5 is the highest score, 6 is the highest score. Just remember, I think you know about everyone. See here, remember one confused word sounds novel. One means what? Oriented. Confused one confused word sounds novel. Okay, remember the mnemonic. One confused word. This one. How you have to do that? Give the scoring here. Okay, mild is a 13 to 15, moderate 9 to 12, severe less than 8, death is a 3. Okay, try to answer these questions and comment in and just comment in the comment box. This is the SAM criteria. Age must be more than 6 months. Bipedal edema. Weight for height is less than how much? Minus 3 G square. G score and the MAC is always less than 11.5 centimeter. Treatment will be the IV. Treatment will be the IV RL. Okay. I go to my charging is. See, and there is acute versus chronic malnutrition. You have to remember the examples here. Okay, now while coming to the pheochromocytoma here, it is also called as waterma. It is also called as chromophenoma because the pheochromocytoma is a tumor of chromaffin cells which are found in the adrenal medulla and sympathetic ganglion. So, if there is a tumor in the chromaffin cells, it leads to the overproduction of the overproduction of the epinephrine and norepinephrine. So we are getting the symptoms like sweating, alpha reactions like hypertension, headache is the most common. Beta reactions like palpitations and increased heart rate. Screening will for the screening as we have to do the 24 hours urine fraction, metanephrine levels, confirmation plasma fraction, metanephrine. For the metastasis is the MIG-B gene. For the localization is the MRI abdomen. Treatment always you have to start with the alpha 1 blocker such as phenoxybenzene here before surgery. For intraoperative, you have to give the IV fentanyl. Post-operative, you have to give the labetalol. Pheochromocytoma crisis, you have to give the nitroprusside. Okay. My PC charging is very less, guys. So remember here, Cushing suspected disease. Okay, Cushing disease, guys. So why you are going to do this one? See here, because we have to know the reason for that Cushing syndrome. Cushing syndrome. Either it is caused by atherogenic cause, either it is caused by pituitary tumor or lung cancer. For this, guys, we are going to do some test. The first one is the screening test of choice. Always it is the 24 hours urine cortisol level. So in this test, guys, actually it must be decreased, but in the case of it is going to be increased. Okay, so the next one is the we are going to do the low dose dexamethasone test. Okay, low dose dexamethasone test. It means we are going to give the 1 milligram tablet to the patient at morning, and you have to check the ACTH levels. Why we are going to do the low dose is that to differentiate between either it is the atherogenic cause, pituitary tumor or lung cancer here. See, if the ACTH levels is low, it means it is the what? It is the atherogenic level cause. If it is still high, if it was still high, then you have to confuse that. Okay, if it is high, then we have to choose either it is pituitary tumor or lung cancer. Then you have to do the high dose dexamethasone test here. If it is, you have to check the ACTH level. If it is low, it means pituitary tumor. If it is still high, it is called the lung cancer. This is ectopic. Okay, na lung cancer. See here, see lung cancer means what? Small cell carcinoma. Then you have to do the CCT of the chest and you have to find out the lung cancer here. Pituitary tumor, you have to do the MRI brain. Okay. Thank you very much, guys.